Excessive grinding is a common problem with people's teeth. You can see the uneven edges on this patient. He's 20 years old though, and you see the central incisors, how the one central has been worn down at an unusual angle. And then when you look closely at the laterals, you'll see more wear. It really shows up quite a lot on the canines as the person grinds off to one side. And you can see how it fits like a glove, and it's grinding down the edges of his teeth. Now, this is something that the patient doesn't do during the day, but is doing it at night. There are some folks that do it during the day and are aware of that, but the amount of force that's placed really is usually will cause someone to stop during the day when it's this excessive, or else the person knows about it. So usually what normally happens is that this would be diagnosed and the patient would wear some sort of night appliance to try to prevent that from happening. His teeth have some recession, which you can see up on that upper right, and we'll take a look at that later. And you can see a little bit more of the wear facets that are occurring. And when someone grinds, they actually remove the next, not all, but different parts of enamel, and they call little chipping and edging of the teeth. And eventually, if this continues, the patient's going to end up having some significant problems when they're older. In some cases, it's possible to see someone grind down their teeth. And this is a picture of the chipping of the edges. And you can see how the enamel's been worn through to the next tooth structure. If a person was whitening, that didn't exposed will sometimes cause pain. These teeth are also a little on the crooked side. When someone's grinding their teeth, they will also oftentimes move them, and they'll also have grooves in their teeth that are relatively significant. This particular person's bite is not quite right, and when he closes in a relaxed position, called centric relation, the back molar on the upper left touches, and then it takes about 2 or 3 millimeters to actually get his teeth together. This patient hasn't had his teeth cleaned in a while, but you can see that he's very good with his toothbrush. He brushes fairly vigorously with a fair amount of toothpaste. Normally, behind the lower front teeth, you would see more plaque and tartar. Problem is that he's removed some tooth structure as well, and that will probably need to be fixed with some sort of gum graft. The grinding also can be a contributing factor. We're looking at the lower left right now. You can see some stained areas that we use a laser, a diagnodent, to determine if that's something that needs to be done. We monitor that, and it looks pretty suspicious with the brown being that large. And we'll go back and evaluate that after he's had other work done. We'll take a look on the other side of his mouth. You'll be able to see a little darker brown stain right there. That's looks like that's most likely decay. The gum tissue on the back of 31 is not completely down away from the tooth, and that gum tissue should be removed so that that becomes a cleansable area. There very well may be decay right in that area that we're looking at right now. That's a relatively simple procedure with a laser. You can also see the red gum tissue where the patient isn't getting his brush back there and has developed some inflammation and gingivitis. There's another look at the dark brown spot that looks like decay on 30. When we look at the upper teeth, they appear to be okay. that type of stain I'm typically not worried about. We're going to take a look at the upper front teeth, though, and you'll be able to see the wear on those teeth. There's the canine with the little yellow spot where the patient has worn through into the next tooth structure. A little bit of a grooving going on the lateral there. If this patient was biting his nails, it would be very easy for him to chip or break his teeth because they're so thin on the edges. You can see on that one central how flat that groove is and into the next tooth structure because he's worn it down so much. Same with that lateral. Here's another picture of the other canine with the yellow dentin peeking through. This patient's teeth are a little bit darker than normal. He would like to have them whitened and also to have Invisalign done. We'll be able to do that using fluoride most likely. This is tooth number 15 that filling was done a couple years ago. You can see the filling has had some sort of leakage and should be replaced. Somehow or other the material probably became moist when it was placed because it's such a difficult area. I have a video that can show what can be underneath that type of filling, and if you go back to the credits, there'll be a link as to how that can turn into a significant problem. There's some of the recession I was talking about before. Usually that's easily taken care of with a gum graft to cover the roots. 5, 6, number 11, and 12 on the other side have that. You see the brown area, that very well may be decay. And when we have them numbed up and checking the other areas, we'll reevaluate that because I don't want to cause them any discomfort. That's the front between his two front teeth. And actually on a full smile, he's not showing very much of his teeth. It might be possible to remove that frenum to be able to show his teeth a little bit more. There's some more of the gum recession, and like I was mentioning before, that's probably, hopefully that's just stain, and we'll be able to cover that root up. This is the other side, tooth number 2 as opposed to 15. You can see how there's no decay in that area, a slight amount of decalcification, but it gives you an idea. This is a picture of the space and the first point of contact. We put a little bit of articulating paper in and have the patient bite down. Ideally, it would be nice to have all his teeth hitting at the same time because we're looking at Invisalign will no doubt straighten his teeth and come back, but this gives us just kind of a little viewpoint to try to do a better job of getting all the teeth hitting together. You can see the space there. When he first touches, when he bites down hard, they all come together just like that.